Hi, and welcome to the Ask Dr. Angela show with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been just too embarrassed or shy to ask your own doctor a question about your, private stuff? Well, you have come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. OBGYN, she keeps it real. Pregnancy, she knows what you're expecting. Whole body health, just ask. Dr. Angela has you covered, girl. And now here is Dr. Angela.
What's good, people? This is Dr. Angela, everyone's self-proclaimed favorite OBGYN, and I would like to officially welcome you to episode 47 of the Ask Dr. Angela podcast. Folks, all I need to tell you is that it is getting ready to go down. I think I told you that Thanksgiving is like my absolute favorite holiday. I mean, my favorite meal of all time has to be Thanksgiving. I literally could probably eat Thanksgiving every day. Between the turkey, and of course, in my house, we do more than just turkey. We have turkey ham. My mom's usually makes a roast beef, and then all the sides, cabbage, greens, corn, green beans, potato salad, stuffing, candied yams, macaroni and cheese, mashed potatoes, all the fixings. And then let's talk about the desserts. Not pumpkin pie, and I'm not trying to be funny. Black folk eat sweet potato pie, though. I'm a black woman, black folk. We eat sweet potato pie. Lately, there's been all this rave and fanfare about the Patti LaBelle sweet potato pie. Well, sorry, Patti, but my mama can bake some sweet potato pie. So I'm not really inclined to head to Walmart to buy your pie, which has to be heated up in the oven. I'll just have some of my mama's sweet potato pie. So, having said that, I recently did a blog post on ectopic pregnancies. Like a couple of weeks ago, I think we posted that. And the reason that I was moved to do that blog post is because I met a really fantastic couple in the ER. It was a young lady and her husband. Obviously, I was treating the young lady. I mean, I don't know many men these days that are walking around with vaginas, although that trend is changing. And I don't mean trend in a bad way, but, things are changing in today's society. But anyway, I saw this woman, and lo and behold, she had an ectopic pregnancy. Her symptoms were, she was minding her business, and then all of a sudden, boom, she had this pain that doubled her over. She was feeling lightheaded. She was feeling dizzy. And so certainly she presented to the ER. They did some blood work. They did an ultrasound. And what did the ultrasound show? The ultrasound showed a mass in her adnexa. And that's just a very fancy word for region of the ovaries and tubes that had what we call a ring of fire. She had a positive pregnancy test. And, hey, she also had a belly or pelvis full of blood. And that was noted not only on ultrasound, but also on exam. She was complaining of significant abdominal pain that was radiating up to her shoulder. And by the time I met her, I already knew what the deal was. And so I just said, hey, I'm Dr. Angela. I'm sorry to meet you under these circumstances, but I'm going to have to take you to the OR because I'm about 99.9% sure that you have a ruptured ectopic pregnancy. That would explain your decreasing blood pressure, why your abdomen and pelvis is so tender, why when I do a pelvic exam and I just barely move your cervix or, press behind the cervix, the blood is an irritant and you're almost jumping off the table. It explains when I lay you back on the table why you're having significant shoulder pain because there's blood. So unfortunately for her, I had to take her to the OR. So just a few quick facts about ectopic pregnancy. When I typically see patients for their established pregnancy visit and we do that ultrasound, the biggest reason that I'm doing that ultrasound is to establish that there's actually a pregnancy inside your uterus. Any pregnancy that is not in the uterus or that is outside of your uterus is considered an ectopic pregnancy. And certainly you can have a pregnancy that's outside of the uterus. It can be in the abdomen, it can be in the ovary, it can be even in the tube. The significance of the quantitative HCG or the pregnancy hormone level is that typically by a level of 1500, I should be able to see something inside the uterus. If I'm not and your quant is about 1,500, it raises my eyebrows significantly. We already talked about some of the symptoms that are associated with an ectopic pregnancy. You may not have any symptoms at all. You may just have the normal symptoms of nausea, vomiting, breast tenderness, or like I said in presenting this patient, that she had the onset of sudden pelvic abdominal pain, dizziness, lightheadedness, which prompted her to go to the ER. And certainly I'm happy that she did, because this could be a life-threatening event. With regards to how we manage ectopic pregnancies, sometimes it has to be managed surgically, as was this case. And when we manage it surgically, we may or may not be able to save the tube. In some cases, and for me, I'm going to say most cases, I find that the tube can't be salvaged and we end up having to remove the tube. There are certain instances, if the patient is medically stable and if the ectopic is not significantly large, along with some other criteria, that we can manage ectopic pregnancies medically. And that's typically done with a medication called methotrexate. But there are a lot of criteria that have to be met, specifically making sure that the patient is reliable before we can even talk about that sort of management. Risk factors for ectopic pregnancies are going to be things like a history of PID or pelvic inflammatory disease. And that's typically caused by the goodies that aren't good. Things like gonorrhea, chlamydia, etc. Previous history is always an increased risk for anything. So if you've had a previous ectopic pregnancy, there's like a 20% recurrence risk. Anatomy is another risk. If you have a history of lots of scar tissue that might distort the fallopian tubes, or if your fallopian tubes are misshapen or kind of what I call anatomically defunct, that certainly will impact the ability of a fertilized egg to travel down the tube toward the uterine cavity. Smoking. And let's just be honest, what isn't smoking a risk factor for? And last but not least, contraceptive choice. So remember, there's absolutely nothing that is 100% except for maybe abstinence. And again, if you buy into the whole Mary and baby Jesus phenomenon, you might not even consider that 100%. But having said that, while things like tubal ligation and IUDs have pretty low failure rates, if you do happen to get pregnant with either of those methods, it's more likely that it will result in an ectopic pregnancy. That's kind of a lot, right? Right. Anyway, I hope that this information has helped someone and that you weren't too overwhelmed with that. Thank you for tuning into this episode of Ask Dr. Angela. If you have a topic or a question that you would like to submit, please go to www.askdrangela.com. Click on the microphone on the right-hand side of the page and do what you do. If we happen to feature your question in the podcast, then someone from my team will reach out to you. We'll get your information and we'll send you one of our bomb-ass t-shirts. In closing, I'd like to leave you with this. And this so puts me in the mindset of a sermon that my dad once preached. He's always using his kids as examples. And I think that myself, as well as my other siblings, my sister Danielle, my brother Donald, have been examples for this particular one about successful failure. So here's the quote. There are no failures, just experiences and your reactions to them. And my dad's whole concept on successful failure was, as long as you learn the lesson, you really haven't failed. So until next time, look better, feel better, be better. I'm so looking forward to reconnecting with you on episode 48. But until then, gobble, gobble.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon! All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any diseases or illnesses and does not and should not replace treatment for a medical professional. Listening to and participating in this podcast does not create a doctor-patient relationship between you and Dr. Angela Jones. If you need medical advice or assistance, you should consult a physician. Listening to and participating in this podcast is subject to the terms and conditions posted at drangela.com/terms.